Hello, everyone, and welcome to the Becker CEO and CFO virtual event. I'm Brian Zimmerman, the custom content editor with Becker's Hospital Review, and I will be your moderator for today's session, Transforming the Healthcare Journey Through More Secure and Connected Patient Experiences, with Dr. David Rhew, Microsoft's Chief Medical Officer and VP of Healthcare Worldwide Commercial Business. During this session, Dr. Rhew will discuss Microsoft's response to the COVID-19 crisis and improving care and the patient experience through more integrated operations. Dr. Rhew, thank you so much for taking the time.
Thank you, Brian. It's a real pleasure to be here.
Okay, so with that, let's dive right in. And just to set the stage here for folks, can you tell us a little bit about your background?
Absolutely. So I'm a physician, I'm a technologist, and I'm a health services researcher. I've been spending the past 25 years thinking about and exploring how technology can be used to improve health outcomes, more specifically access to care, quality of care, ways that we can remove waste from the system, improve efficiencies, and improve the overall experience for patients and providers. And on that journey, I've gone through an electronic world journey where spending time building systems that are part of clinical decision support to help provide the right information at the right time to providers. I've learned a lot about how technologies need to be implemented and can be done within that type of setting, but really started spending more of my time thinking outside of the hospital setting, looking at the patient and the consumer. Spent the next 6 years looking at how consumer technologies, as Chief Medical Officer at Samsung, could be used to drive greater adherence and adoption towards evidence-based protocols, provide greater information, and most importantly, engagement. How do you get patients and consumers engaged in their health? But one of the challenges that I ran into, and I think the industry has run into in both scenarios, was that data was siloed. It was locked into these different systems. It could be your electronic health record, it could be a claims database, it could be a wearable, or it could be some kind of device. Where the real opportunity lies is if we can unlock that data, bring it together, normalize it, and then apply analytics, AI, machine learning, and become much more proactive in our understanding. And that's what brought me to Microsoft. Joined Microsoft about a year ago, served as the Global Chief Medical Officer. And what we're doing is we're helping to build those type of platforms, those systems that bring data together, allow us to be able to get those greater insights and hopefully deliver better care.
Excellent. Thank you for sort of setting the stage there, as I mentioned. And then speaking about Microsoft, I don't think it's any secret to our attendees that Microsoft has definitely deepened its presence in healthcare in recent years. So can you talk a little bit about Microsoft's evolution in the healthcare space?
Yeah, I think it really starts with the mission statement. Perhaps at one point we were heavily focused on the technology. I believe the mission was putting a computer on every desktop. But about a decade ago, we changed that, and it's now about empowerment. It's about helping our customers, helping the clients, helping patients, helping hospitals, care providers achieve more, to be able to achieve their goals, to be able to do what was not previously thought possible. And so by serving as a technology enabler, we can potentially help these individuals, organizations across the globe achieve their goals. And that has allowed us to be able to rethink within the healthcare technology space, what are the ways that we might be able to lean in and provide that greater guidance and assistance. And some of the areas that we've recognized relate to ways that we can enhance our understanding of the individual, this concept of individualized or personalized care. Being able to understand how we can coordinate care between care providers and individuals in a virtual manner, and sometimes in a synchronous or asynchronous manner. Pull data together, draw insights, apply AI, and then again, become much more proactive in our communications or in our actions. And those are the types of things that we're looking at today that allow us to be able to understand how we can apply towards a greater future.
Great. And so then can you tell me about, I want to pivot here and get to sort of the issue at hand that we're all thinking about. And I wonder if you can tell me about Microsoft's response to COVID-19 and how has the pandemic influenced your organization's work with providers?
Well, one of the things that I guess is part of my background that is relevant to this story is I'm also an infectious disease physician, and I trained during the AIDS era when we saw patients, and many of these patients were suffering from a virus that we couldn't treat. We saw them die in the hospital. It was a tragic time, but it allowed us to be able to understand some of the key things that we need as a nation, as a global community to address these type of epidemics. Information sharing, being able to accelerate the pace of delivery for medications. And this is something that we also have been heavily involved in at Microsoft. When the pandemic first hit, and in particular when it hit in the United States, one of the first areas was in a nursing home in Kirkland, Washington, which, as most of you know, is in close to Seattle, or a part of Seattle, and that's the home of one of the larger health systems in the area, Providence Health System. Well, Providence is also one of our strategic partners, and Microsoft is also located in that area. So it hit us personally. We knew this was going to affect our community, and one of our key partners was leaning in and experiencing many of the challenges. One of those challenges was many people wanted to know, do I have the infection? Do I need to come in? What do I need to do to take care of myself? And simply looking at a website to figure this out isn't good enough. You actually need individualized recommendations. I just came back from a recent travel. I think I may have been exposed. I have a fever. I've got loss of taste. Should I come in, but I have no fever? These are all the questions that people would have. And because the call centers were so overwhelmed, they actually would find themselves rushing to the ERs and urgent cares, and in some cases sitting right next to a person or close by to a person who was infected. And so we're creating this environment where lack of information was actually enabling the spread of the virus. So what we did is we took some of the AI-based chatbot technology that was previously developed for more consumer-oriented types of call centers, and it enabled us to be able to then adjust that using COVID CDC criteria, COVID-specific criteria, and ultimately deploy that to some amazing results. We found about a 30 to 40% reduction in the call volumes and a subsequent decrease in the foot traffic to the ERs and the urgent cares. And this gave us really the first opportunity to understand how technology can be applied in the setting of a pandemic to address one of the most critical urgent needs. And in fact, this technology, while it had great value and benefit to what we saw early on in Washington, it has now been widely adopted across the globe. Over 25 or 26 countries have adopted the COVID technology, the COVID-specific bot, which I'm talking about, including organizations like the CDC, and there have been over 600 million messages delivered, like over 500 million of these messages, enabling individuals to receive more appropriate care. And then that's now allowed us to be able to understand, if you understand where an individual and what an individual needs, we could then do a natural handoff to virtual care visits. So many examples of how we've been able to identify opportunities where technology could come in, greatly address some of the acute and longer standing needs that people and organizations had.
I think it's fascinating when you think about sort of Microsoft's, your mission of sort of developing more individualized care, and how the pandemic has shed light on just how important that is, right? You can't take its blanket approach to sort of dealing with these patients and their concerns. So I'm curious, like, what have you learned over all that time, all that data you've collected, all that information that's come in, all that effort to talk to these folks and give them more tailored responses? What have you learned in this time?
Well, as you indicated, one of the most important things is really getting that personalized, individualized approach. And what we learned is that there is a great opportunity for us to enable that care coordination, and technology can help us in that capacity. During the time that we were planning prior to COVID, we were planning to launch an effort called the Microsoft Cloud for Healthcare, which was an opportunity for us to be able to take all the healthcare specific components that we had been maturing over the past many years. We're talking about the Azure-based chatbot, which I mentioned. We're talking about the AI capabilities of voice to text, and then converting that into a format that could be brought into the medical record. We're talking about HIPAA-compliant Teams capabilities to do virtual care visits. All of these pieces, along with FHIR APIs and a variety of other mechanisms, were things that needed to be stitched together in clinical workflows. And so what we realized is that when you think about the patient journey starts where they're at. And the individuals that are interacting with them may not necessarily be your doctor at first. It may be your frontline worker, the call center agent, it may be the case manager, it might be the visiting nurse. Those individuals need the same type of tools, the decision support tools and information to know where you are on that journey. And once you actually understand where the person is on that journey and what you can do to provide information, whether it's through an AI-based chatbot that gives you a structured interview, or perhaps it's through remote monitoring data that gives you information that this is an individual at higher risk, what you then can do is you can then coordinate that care at that moment and be much more proactive. So I'll give you like one example. I'm at that age right now where I'm not sure if Brian, you're at this age as well, but it's appropriate that I receive a screening colonoscopy for colon cancer. Well, having to do that during the pandemic was not easy. In fact, I remember scheduling it and then having it canceled because there was no procedures available at the time. And then 4 months later that we got it on the calendar. Well, by the time I actually needed to get this procedure, what happened was the prescriptions were all invalid, and I had to call back and have the doctor re-prescribe them. And then I had to take, go through all my emails and figure out what I needed to do to take, stop the medicines within a week. You're talking aspirin. You had to go ahead and make sure 2 days before you had to do this. And then they added a COVID screening test on top of that 3 days before. Well, if I would have missed any one of those things, that procedure would have been canceled. And that is the world that we live in today, where much of healthcare is dependent on individuals doing everything they can to get the right care. And there being multiple single points of failure that allow us to be able to basically fall through the cracks. And so what we're now thinking about is with these integrated, coordinated systems, we can build in these levels of redundancy where technology can help us and can provide an opportunity for us to keep patients on task, support them in their needs, and then help providers become much more efficient. So real exciting time for us. That has been probably one of the exciting opportunities for us to accelerate the launch of that. And in fact, it'll be launched later this month.
That's definitely exciting, and I am rapidly approaching that phase in my life where I will need that regular exam for sure, that regular screening. And so then, can you talk even more about the Microsoft Cloud for Healthcare? Can you give us some more details about it and how it will help providers?
Yeah, I think one of the things that's real exciting is that we have, in many ways, been testing and validating many of the components that you'll see within the Cloud for Healthcare. Let me start with Teams. Teams, as much of people know, is a great communication tool. It is one that allows us to be able to have conversations with people, do video consults. Well, what we realized is that to make this healthcare specific, we need to make it HIPAA compliant. Okay, great. But doctors and patients and doctors and clinicians to clinician like to talk about the medical information. We want to know what the lab result was. We want to see the x-ray. We want to be able to communicate. So to do that, we actually can now, through Fire APIs, pull data directly into these type of environments. And to collaborate now with the information that allows us to be able to have very specific discussions on the person's healthcare is something that is now enabled through the process of the Cloud for Healthcare. That same Fire API can allow us to be able to pull information related to a patient's journey. So let's imagine I'm a patient that has just received, is called in, wanted to schedule that colonoscopy. Well, as the person is scheduling it, it pulls it runs a Fire API and realizes that I've missed my last 4 appointments. Why is that? Well, you can run through the AI-based chatbot and it says, ask them if there's an issue around transportation. Well, it turns out that I lost my job and money's been tight and I just wasn't able to get the bus token. Well, if this is really important, then perhaps maybe there's an opportunity here to address that up front. Provide the voucher, provide the opportunity to even do a scheduled ride share or a scheduled one of those Uber or Lyft types of visits. And so what we're recognizing is that we have an opportunity in many cases to identify issues that have oftentimes emerged much later on in the conversation with a doctor or a pharmacist. But by pulling information, we can actually, through a series of APIs and through structured protocols, identify these issues and then act on them. And that's allowed us to be able to sort of rethink what those clinical workflows. And I'm going to close with one other workflow that we have found to be particularly important. Once that interaction is complete, it ultimately needs to go into the medical record. And a lot of the conversations that we had with doctors and nurses and pharmacists and other clinicians was entering that back into the medical record was a significant lift. And so what we realized was that if we could use our voice, the conversation that you and I are having, and imagine this is about my colonoscopy or your future colonoscopy, and that were then to be captured from voice to text. And then the system actually understood the terms and allowed us to be able to organize that into a medical note. And then you could push a button and it could go directly into the medical record. Well, that capability is going to be launched with the Microsoft Cloud for Healthcare. Through our partnership with Nuance, we have a product called DAX, Dragon Ambient Experience, which allows us to be able to do all those things. And that has been shown in some of the early pilot studies to have a 50 to 75% reduction in the amount of time it takes to document into the EHR, and an improvement of 88% on clinician satisfaction relative to documentation. So a hugely important element that we're trying to streamline that process of understanding the patient, coordinating the care, and then delivering more efficient care for the clinicians.
When you talk about documentation as well, my mind definitely goes to thinking about reimbursement, right? Thinking about the financial state of perhaps some of the folks listening to this right now. So I'm wondering if you can talk a bit about how new technology or innovations can sort of help providers work through this financial recovery period that they're likely going to be in for a bit once this pandemic finally subsides.
Well, there's a couple of elements to that. First off, we have seen that there's a significant push toward virtual care, and we're going to continue to see elements of virtual care persist even beyond the pandemic. That's going to be a big part of how patients will want to be seen by doctors. We're going to continue to see innovations that allow us to be able to expand virtual care beyond the visit, include remote monitoring and sensors, so that we can get a more holistic picture of what's happening with the individual. And hopefully with all that data, we should be able to get a bit deeper understanding of what's happening, not only now, but what could happen in the future. So this element of prediction, being able to identify high risk, high cost individuals, who's likely to come into the hospital, who's likely to actually have complications, will only be accomplished by having these systems that allow us to be able to capture the information and then be able to then apply AI on that. And that's going to allow us to potentially leverage the value-based care principles and the contracts that may be in place that support the value-based care to take greater risk, to be able to assume opportunities where you can take on populations and understand that you've got greater confidence in your ability to manage them. I think this is really the opportunity for us to be able to double down on these technologies and apply them in a context that allows us to be able to achieve those business goals.
Absolutely. And then so thinking about the future, and virtual care is here to stay, and remote monitoring is certainly going to play a role moving forward. But in your opinion, I just want to get your take, if you want to pontificate for a second. So in the next 5 years, what will be the biggest change to healthcare delivery?
Well, one of the things, as I mentioned, is there is an element of consumerization. Certainly that we know virtualization of care, that's certainly going to be important. But where I do think that the greatest and biggest impact will be with AI. Our ability to understand, once the data are brought in, normalized, and we're seeing some significant movement towards interoperability and pulling different data sets into a common platform. I mean, we oftentimes talk about electronic health record and payer data as being core. It's actually about 20% of all that impacts one's outcome. We recently launched a DICOM server, Fire server, that allows us to be able to take the metadata from images, be able to include that into the overall picture, allows us to be able to, we also have a Fire connector for IoMT, or Internet of Medical Things, pulling in data from these devices like wearables and patches and weight scales and all the other types of things that may have Bluetooth enabled components. All that could be brought in. And then social determinants of health, all the influencers of health, the zip code, all that information can then be brought in, but that information has to be analyzed, and we have to understand how we can risk stratify. Patients who are of a certain cohort may have a different trajectory than others. A great example is with COVID. What we've recognized is that for some reason, people respond differently to the infection. And while we may say that, oh, it's because of age, even within the older group, some people respond differently. They may have underlying issues related to comorbidities. They may have, perhaps they may be on certain medications, or perhaps maybe they just have a different immunologic response. And so this is an area that we've been spending a lot of time looking at, the biology, the genetics, the genomics behind this, and understanding at a very individual level what makes us so unique and special. What, for instance, in COVID, why are some people's immunologic responses suboptimal, and some that are hyperreactive and some that are appropriate? And so if we were then to be able to apply that with all the other factors, we may be able to then develop much more predictive analytics, which then leads to actions which we can take. We can be much more attentive for those that we're concerned about. We may even want to apply monitoring for those, or for those that we feel pretty comfortable with, we can then space out some of the visits. And this is really where care needs to go. We need to be much more precise. I can tell you when I was back in my day of practicing, the question that always came up is, when should I see the patient next? Well, it was either 3 months or 6 months, or a year. 3 months, 6 months, or a year. And so that was really the choice we had. It really wasn't based on any science. It's just based on the fact that it's the way we did it. Wouldn't it be great if we actually could get very precise in terms of our understanding? And that's what's going to allow it. The AI is going to help us with answering those questions, which will lead to better, more efficient care.
Yeah, absolutely. I want to touch on at least this interoperability piece, right? You're pulling in all this data from all these different sources. What are the barriers that need to be overcome there still? What still exists that you think sort of AI and these new tools can help the industry finally knock down some of these barriers?
Well, we're seeing many of those barriers being brought down with this new CMS interoperability rules. I think that that's a huge step forward, but it is just one big step. We need multiple big steps, and we need the momentum to continue. If you just think about where we're at relative to interoperability, there are still many data sets that we do not have terms defined specific for fire. There's great efforts underway. I'll cite the social determinants of health efforts, but we're nowhere near the level of capturing all the different types of terms and the variables that we see and the taxonomies that are appropriate for each of the different things we run into in clinical practice. But we're getting there. And that's the real exciting thing, is that we're recognizing that care is more than just about a lab value, and it's more than just about a visit. It's about the holistic care that we, or all the things that happen throughout our daily lives. And now we have mechanisms to be able to capture them. And if we can capture them in seamless ways so that patients are not having to enter them in manually, then we've created a system that is workable.
Absolutely. I mean, it's heartening to hear that the progress is really being made on that, just because in the 5 years or so I've been talking about healthcare and covering healthcare, it's been such a thorn in the side of advancement, right? Is this interoperability issue? I'm going to throw one more question your way before we move to takeaways, because I know we're coming up on time, maybe one or two. But the question I want to ask is, what do you see as Microsoft's biggest strength here and asset specifically to healthcare providers as sort of this digital transformation occurs, right? Like, what distinguishes Microsoft in this space?
Yeah, I mean, there's so many things that you could talk about, the platforms, the focus on healthcare specific, but I think the one thing that really stands out is trust. Microsoft has taken extraordinary efforts to build that trust and maintain that trust. We do not monetize data. We are very transparent in our policies. We are hyper concerned about how this technology can be used, not just for the current purposes, but potentially misused down the road. If I think about some of the things that we have done relative to our position statements around use of artificial intelligence, or I should say facial recognition. I mean, we took a very strong position here on what we will not do and what we do not recommend. We took a very strong position around how contact tracing applications need to be applied to preserve patient privacy. So we know technology can do so much. There's great opportunity, but we also have to, because we're paving the path forward, we have to take a forward look to see what are those guardrails that we need to put in place to make sure that we don't fall off and do something that was unexpected and potentially cause harm. And that is, I guess, really a philosophy that we've taken that has enabled us to be able to become one of the trusted partners for many organizations across the entire spectrum, not just healthcare, but across multiple different industries.
Yeah, I imagine that trust is so important when you're talking about something like artificial intelligence, when you have so many, I imagine, misconceptions about the technology or fears about it. So I think that's a great point to end on. And I'm going to throw it back to you, Dr. Rhew. What are one or two key takeaways you really want our attendees to leave this conversation with?
Yeah, I think really one of the most important is that we recognize that we're on a journey. We still have many steps to go, but we've made some great progress. One of the things that I am super optimistic about is the fact that we now have standards in place around FHIR and interoperability. We've got an ability to leverage the cloud in ways that allows for secure data access and control and movement of data. We can stand up systems like literally within days to weeks. Thinking back to the pandemic, it would have been very difficult for us to be able to have addressed the pandemic had we not had cloud-based technologies and some of the tools that I mentioned that allowed us to deliver in a very responsive manner. So I think that as we think through how technology can help us, there are so many great opportunities, starting with the patient, allowing us to understand that patient journey, coordinate care better across that journey, support them, those patients, but then also extending to the clinicians. The clinicians drive a lot of healthcare, and making sure that the clinicians understand that we're here to support them as well, that we're going to build the technologies and support them in ways that alleviate some of the stress and the administrative workloads. And in the end, deliver on the promise of what technology is delivering on better population health.
Great place to end this conversation. Dr. Rhew, it's been a real pleasure. Thank you for taking the time.
Thanks, Brian. A real pleasure as well.
And thank you to our attendees for taking some time out of your day to be a part of the Becker CEO and CFO virtual event. Please be sure to check out our other great sessions during the forum and let us know if you have any questions, comments, or feedback. Thanks again for joining us, and we look forward to seeing you at future Becker's events.